So what's the real difference between therapy and coaching? I get asked this a lot, not just in words, but also with like fear in the eyes of trainee coaches or people who are training in coaching skills, where they're just really concerned because we get told, you know, we don't want to be therapeutic, coaching isn't therapy, blah, blah, blah. And also there's quite a lot of ethical considerations that we go through in the coaching course, which I won't go through here. But I'm going to give you like a whistle-stop tour of it. One of the big reasons is because obviously people in the therapeutic space or psychotherapists or counsellors, they might be more adequately able to deal with mental health issues. As a coach, we are not dealing with mental health issues. And so there's a whole host of advice, you know, around red flags. And that includes, you know, things like anxiety, depression, trauma, etc. We certainly want to be avoiding re-traumatizing people in the coaching space. And it's not necessary to get people to share, you know, and relive traumatic stories, for example. So there's that side of it. There's the side where if we see sort of potential mental illness going on, we need to kind of raise that issue and maybe refer. But then there's this whole thing about, you know, therapy is supposed to be more looking at the past and coaching is supposed to be more about the future. Now, obviously, both are about both. No therapist doesn't talk to you about how you're moving forward, and no coach doesn't let you talk about the past. And what I think happens with trainees is that they get into this space where they're like, okay, therapy is about emotions and the past. So therefore, I can't talk about emotions or the past. No way. And some people maybe don't feel comfortable doing that, but that's certainly not the case. Yeah. What it is with coaching is that you want to look at the journey that you're taking someone on. Ultimately, there should be the ability to ask the questions about what have I learned, who do I want to be moving forward, and how am I going to move forward, and where am I going, right? If someone's not able to do those things, then that's a sure sign that actually therapy might be more appropriate for them because they're still sitting in the pain or they're still processing a lot of stuff. So you will see it. You will see when someone comes to you and they're more in need of therapy, because every time you try and talk to them about anything, you know, for example, they might be going through a breakup, they'll only be talking to you about how awful that relationship was and how painful it was, instead of, okay, what did I learn and how do I want to move forward? It is very, very clear when someone's in a sort of vulnerable place where they're just processing and they're more sitting in the pain rather than able to look forward in any way. If you're taking someone through a journey and part of that is talking about emotions, in fact, it has to be, because the ICF competencies hold a lot of kind of empathy, looking at emotions, all of that is in there explicitly. If you're holding space for emotions, if you're looking at the past to create awareness and to reflect, and then you're looking at moving forward, then that's fine. And you don't want to put a value judgment on where you're at any point in the session. It's dynamic. It is over time. It's not, oh my God, we're looking at the past right now, so now it's turned into therapy. Oh my God, abort, jump ship. No. So they are not totally different, and you can't do anything therapeutic, like, you know, about emotions or the past in a session. Of course not. It's about the kind of overall tone of the session and the overall focus of how you're working with someone. I hope that helps.